This is a pleasant 45-year-old male who sustained an Achilles tendon rupture while playing soccer approximately 4 months prior to coming in to see me. He was concerned about weakness in the Achilles and wanted to discuss surgery at this point. You'll see the animation and the video coming up.
Using the Achilles jig for the mid-substance speed bridge, a percutaneous incision is made in a transverse manner just proximal to the palpable rupture. The tendon is grasped and the jig is inserted with the inner arms inside the peritoneum of the Achilles tendon. The pars needle is placed in the number 1 hole of the jig to stabilize the construct while passing the other needles and sutures. The jig is then removed, pulling the sutures out of the incision. Pass the blue-white suture tape under and around both green-white fiber-link sutures 2 times, back through the loop, creating a locking stitch. 2 stab incisions are made directly down to bone, 1 centimeter below the superior aspect of the posterior tuberosity, medial and lateral to the Achilles tendon. Within these 2 incisions, drill and tap at 45 degrees from the center line of the Achilles in the coronal plane, 45 degrees from posterior to anterior in the sagittal plane in preparation for later swivel lock insertion. A banana suture lasso is passed through the distal stump of the Achilles out of the rupture site. The suture tapes from the proximal stump are then passed through the distal stump out the incisions distally. The suture tapes are now placed in the 4.75 millimeter swivel lock anchors. The foot is plantar flexed 10 to 15 degrees to approximate the tendon ends. Anchor is placed in the prepared hole to secure the suture tapes. The same steps are repeated for the suture tapes on the other side. The result is a secure, knotless repair of the tendon rupture.
In this video, the patient is approximately 3 months post-surgery, fixing his Achilles tendon rupture. He's able to walk normally at this point and no longer taking pain medication. He has returned to work and he's able to perform a double limb heel rise test and with the single limb heel rise test on the surgical limb. In this video, he's approximately 4 months post-op, doing very well. He has a normal gait, no longer on any pain medication, and has returned to work. He has not yet returned to any soccer activities from which he injured his Achilles tendon, but he's very happy with the repair. As you can see in this next video, he has increased calf girth, and he's able to perform the single limb heel rise test. You can see it's a linear incision, as this is a chronic injury versus an acute injury where we use a linear incision.